Solon Chamber of Commerce Employee Wellness Program. We're super excited to have some experts from the Cuyahoga County Public Library, Be Well Solutions, as well as Recovery Resources, and our board chair, George Pilot, will be facilitating this discussion. It's just 9 o'clock now. We're going to give it about 1 minute for folks to get into the room, and we'll go from there. But if you have questions or if you're having any issues, please feel free to use the chat function, the raise hand function, what have you. We'll certainly be able to get your questions answered, or if there are any technical difficulties. And information following today's presentation will be on our website and also posted to our YouTube channel. So we'll give it about 30 more seconds, and then we're going to jump right in and get started. I get one more sip of Diet Coke in. All right, it is 9:01. So once again, to those just joining, welcome to the Solon Chamber of Commerce program for Wednesday, October 28th, Employee Wellness, continuing on our path of a journey through COVID-19. We're excited that you're here, and we want to make sure that we get your information that you need. This program is a result of our members reaching out and saying, what are other companies doing? How are they handling this? What's going on? So we're excited to have some content experts here today to share their different perspectives on employee wellness and maybe what it looked like before the pandemic and then during the pandemic and as we move forward. Quick update on an agenda. The welcome is happening now. The program will be facilitated by our board chair, George Pilot from Masnick, Raskin and Ryder. Super excited to have him here. So I'm only going to talk for about 30 seconds, which is exciting for most people on this call, that they will not have to hear from me. And then we will obviously, during the course of the program, make sure that we're getting questions answered. A couple of things about some upcoming programs and events. Our next program is November 11th, and that's going to be around on-site testing and solutions, continuing where we are and where we are going. That'll be November 11th, and then on November 18th, we've got a local coffee shop opening in Solon, and that's Heritage Coffee over on Station Street. That is Wednesday, November 18th. Before turning it over to George, I just wanted to give a 30-second overview of mental health and wellness and how it's it's affecting me. I have a senior in high school who can't wait to go to college, which is normal for a senior year, but certainly added to with this. I have a 9th grader who we have unsuccessfully found a school option for due to learning challenges, but pandemic anxiety going from that. My wife is working from home for some time. And then, this morning I said, I'm going to run an experiment. I'm going to open up 4 different news sources and see if any of the headlines match, and none of them did. So that was sort of how my day started, what my life is like. But I'm super excited to be working with each of you in my role at the chamber to bring some knowledge and insight around mental health and wellness. So I am going to turn it over to you, George. I'm going to ask you to unmute, and we will take it away.
Great. Well, thank you, Tom. And good morning, everybody. My name is George Pilot, as Tom mentioned, and I'm the chair of the Solon Chamber this year. I'm an attorney with Masnick, Raskin and Ryder here in Solon. And everyone always says at the beginning of every kind of webinar how excited they are to present the various programs that they're giving. Tom Bennett even used the word excited 3 times in the few minutes that he spoke. So I am not going to say that we're really excited to be able to present this program today, but we are really excited to be able to present it today, truly. We have a great panel. We've got some tremendous topics to talk about. As we work through the pandemic and as the Solon Chambers, we look to bring information to all of our members, content that's useful, takeaways. We felt that the one aspect that was not being talked about enough is probably the most important part of every single business, And that's the people that actually do the work, that make the machine run, that actually keep the business flowing. And that's the workforce. Those are the employees. Those are the workers, the people that are actually making the business operate. So with that, we wanted to put together, and big thanks go out to our Tom Bennett, of course, Kaylin Mills, our program people, Denise Mulholland and Julie Liedtke, who put together a great program. And our presenters, I will give them a chance to introduce themselves when they start. And that's going to be Kevin Beaver from Recovery Resources, Bill Frankel from Be Well Solutions, and Julie Liedtke from the Cuyahoga County Library, the Solon branch. So there were three topics or three issues that we felt kind of wanted to frame the discussion today. And one of those is, what exactly did employee health and wellness look like pre-pandemic? What were some companies doing? What are some best practices? What are the topics that the wellness would cover? And then second, how has COVID changed this? Obviously, COVID has changed the way we do virtually everything in our life, business and personal, but how has that affected employee wellness and health? And then the final piece is kind of, what challenges and opportunities have our presenters seen in their various business and their practices as it relates to employee wellness, employee health, employee interaction, and all of the things that go into that. So that's going to kind of frame most of the discussion that we're going to have. We have some other points that we will bring up a little later. We absolutely want everyone to share, feel free, share questions. Please send them in the chat to Kaylin or Tom, and we'll make sure that we answer them as best as we can towards the end of the program. But we absolutely want people to bring up questions, things that they may be experiencing that others may too, and that our presenters can then address and help everyone get even more out of the program than we hope that they will achieve with what we have planned already. So with that, I will turn things over to our first presenter from the Cuyahoga County Public Library, the Solon branch, the manager, Julie, and let her give a little introduction and then go through some of her points.
Hi, everybody. Yeah, this is Julie. So I know some of you because I was pleased to become part of the chamber board this year, and jumped on the programming committee. And one of those things I haven't learned yet is that, you know, when you say yes to stuff, then all of a sudden you're also speaking, which I am very happy to do. And my name is Julie Liedtke. So I've been with Cuyahoga County Public Library for almost 18, I guess about 18 years now. And Solon is my most recent. I just came to Solon last year, so I've been here about a year and a half. I was at the Orange branch previous to that. I've also worked at the Beechwood branch and the Mayfield branch in various capacities. And it's been, but I've actually been working in libraries since my youth. So been working in libraries for over 30 years, basically. And it's been, it's been an interesting ride just seeing the changes that have happened, because when you're in a public library, you really are part of the community and you are seeing just, day by day what's happening both in your community and within your organization. But today we're going to focus on, health and wellness. And as George mentioned, your organization really is only as strong and healthy as the people that we work with. For Cuyahoga County Public Library, and hopefully most of you are familiar with the library system and what we do and who we serve and what our mission is. This system has over, when you think about it, over 500 employees in various capacities, working in different buildings in many ways. We here at, just to kind of focus in even just at the Solon branch, we have many different jobs here, from those that are working at the circulation desk to our pages that are returning material, putting materials back on the shelves, to our librarians and assistants, assisting customers and that. And the library has changed so much over the years. It's something different to everybody in what they need and what they want when they come into the library. And, in many ways, yes, we are still, helping people find good things to read, but we are also a social services point. I mean, many people are coming to us because they have no other place to go. They need computer services. They're looking for a job. They need a place to bring their children and that. And so, we're working with many different people with many different needs. So it was really important is that the staff is supported in dealing with all of everybody else's issues. And so health and wellness pre-pandemic looked pretty much, we have, of course, health insurance for our bargaining unit staff. We also work with, just our employee assistance programs like Impact Solutions. We also partner with Be Well Solutions. Some of the things that we were dealing with even pre-pandemic is keeping our staff and our community safe. Just looking at security and our vulnerability, and also certainly working with our customers who, had, you can definitely tell have some, mental health challenges, and working, trying to assist them while also keeping us safe. And it's stressful. So while we're also having a blast, helping people and, getting people what they need, and trying to do the best, it does have an impact on, when you have difficult interactions and that with customers, and then also trying to keep yourself grounded and not take it personally, when people are calling you names and that, and just, trying to help. So a lot of the things we already had in place, and, just letting staff know that they're supported, and, me as a manager, a branch manager, trying to find the best ways, working with administration to support staff. We also have a CCPL, a wellness committee that regularly puts out tips and techniques. Sometimes we'll have like wellness, programs and activities and that, just to keep our staff engaged and, knowing that we'll get through this together. So George, did you want me to go into then how has COVID changed this? Oh, he's muted. Well, okay.
Yeah. Yes.
Yeah. Okay. Okay. So,
Get you to hit kind of those 3 points, and then
right.
we'll move into a few more specifics as we keep going.
So when we came into February, March, the library then ended up having to close, and it was, that was pretty much mind blowing, I think, to all of us. We were a very busy system, doing so many things, but there was a lot of stress in how are we going to keep things, moving. And, when we ended up, then having to close. So all of the protocols and procedures, of course, we were trying to keep our buildings clean. Pre-COVID, there was no, mask mandate, all these protocols, and that we're doing a lot of the same things that, that have always been prepared to do. What COVID changed is that what were once recommendations, once we were getting into cold and flu season, we would always say, tell people, stay healthy, do these things to keep healthy. If you're sick, stay at home and that. But once we're all, were recommendations, the way I was looking at this was that it also then became a necessary protocol. We were such a community gathering space. We, the library was, everybody come one and all. And then we had to completely flip once we reopened and say, well, now we can't have, tons of people coming in, all at once. And, we want to still be able to, give the services that, people have come to depend on, but doing that, in a safe way. So when we reopened, things, looked a lot different. We had to, of course, you'll see partitions, shields and that at our desks. We'll have, we've moved a lot of the, tables and chairs for social distancing. And of course, there's the masks. And at first, when we were reopening to the public, and this was about the time where there was, this past summer when there was changes happening, throughout the state as well. We weren't going to, it was going to be a strong recommendation. And then we decided that to be as, as safe as possible, we would have to require masks and wearing masks, the whole time that you're in the building and that, and for the, so it's, where once we had, once there were suggestions, especially in many of our public buildings, whether they be a grocery store, or the library. But once where there was just suggestions, now they have to be enforced. And that's what's, I think kind of the pivoting thing and how, and the effect that it has on not only our customers, but on staff, on how we have to try to manage that. The challenge, of course, the big challenge is trying to be as normal as possible in providing our services, but having to do it in such a different way. And there are so many differing viewpoints and opinions on, the state of the virus and what it does and how it actually spreads. And, we've put many protocols and procedures in place to try to, do the best that we can. And it's just, it's not always easy, but, we are offering now curbside service. Some of our branches have drive-up windows. And so that's, that has been a great resource. Some of us don't, such as Solon. And when we reopened, at least for curbside we were one of two branches in June that were doing curbside. And people have, that has been a great thing for many of us. It does put, staff in kind of a different way of having to provide services, running things out, all day long and that. But I've got a really great resilient staff, and, our main goal is to do our best for, for those that need us. So that's, those are just kind of from a public facing organization where, many people, when we just have people coming in for so many different things. Some of them, are coming in just to, grab a book and go, something they've ordered. But we are more and more starting to see people come and start to stay all day long, again, using our study room for meetings. We have had, students and that who, may need our Wi-Fi to do their schooling. And so, as people kind of start to come back in and, start to stay for hours at a time, it's, having now to wear the mask the whole time. And what you see up on your screen is just kind of one of the many talking points that we try to, get across. There's a lot of people that do come in that, they say, well, I have a medical condition, and so the governor says I don't have to wear a mask. And, it's kind of trying to find the right connection with people and having them understand that they're in a public place, and we are making as many accommodations as we can. We will bring your materials out to you. We will, give us a call, and we will look up the information that you need, and print it out and, bring that out to you. But so one of the things that I'm really looking forward to in this presentation is hearing from Bill and Kevin on how they support those of us that are in these, working with so many people all day long, and, being able to support staff in trying to manage so many people's different feelings. And actually, Kevin from Recovery Resources, the library was already partnering with him even pre-pandemic to do mental health training for our staff. So it was, quite fortuitous. We were just in starting to get those going when the pandemic hit. And of course, they had to be put on hold. And he's now working with us again to do some training via, online, just the whole scope it's just magnified now that we are, actually living kind of what we were in some ways maybe, getting ready for. So that's kind of my overview on, what's happening here at the library. And I would, love to be able to also take, as we get into the conversation some more, I can expand or, answer any questions on specifics.
Well, I have actually one very, hopefully a quick point to ask you before we move on to the next part. Is you mentioned, using Kevin and Bill. Do you find then that you're leaning on them or looking to them a little bit more and seeing that that's more important in dealing with the challenges that staff is facing as the COVID has changed the way we're doing business?
Yes, definitely. It was when we returned, and the mental health trainings that Kevin was doing, was on hold. I'm also on, so the library does, does have a union. And so that also presents even, some interesting dynamics with how, employee relations go. And I'm on the labor management committee. And it was one of the first questions that I brought up in that, as we were starting to really, in July when we reopened, and, within weeks, it was evident that this was going to be a long, hard road for staff in dealing with, some of the issues of being open, trying to stay protected, trying to protect the community, and, just trying to work with those, our customers who had different viewpoints on how we're doing that. And so, yes, definitely, with Be Well and, Recovery Resources, with our administration and our HR department are in regular contact with them in, providing programs, resources, and constantly reminding our staff that these are available to them.
I think those are key points that, number one, I think a couple takeaways, number one is employers to, being more sensitive to the fact that employees are facing challenges that they have not faced before. Second, making sure that as an employer, you're taking advantage of resources that are out there that can help in these situations for professionals who know what they're doing and do this every day. And also, making more of an effort to keep an eye on employees and keep in tune with what they're experiencing. So, Julie, thank you. And we'll come back because I'm sure there's going to be some other questions as well. But I do want to shift to Be Well Solutions, to Bill Frankel, and allow him to give himself a little introduction and talk about what their company does, but also, again, talking about what are companies doing for wellness, the importance of wellness checks, and how to help the employees during these times. So, Bill, I will turn it over to you.
Well, thank you, and good morning, everyone. And first of all, I'd love for you to, I hope you're all doing well. I hope you, your families are all safe and healthy. And that's what we're starting with all of our clients, is we hope that all of them are safe. And we know that everyone's going through so much right now. And it's not just the physical well-being that we're talking about anymore. Certainly between the political climate and the racial climate and COVID, and change is threatening for people. And that's one of the main things we're seeing is change is a threat, and it's impacting all of you. It's impacting all of us, and those of us that have kids at home, those of us that don't want our kids at home, those of us that are working from home, that have our spouses at home for the first time. And we have great relationships when I go to work and our spouse goes to work, and now we're both working from home. We've been inundated with story after story of different scenarios of what people are going through and how to cope, and what we'll talk about in a little bit, sort of how to, or at least try to, make lemonades out of lemons. So again, my name's Bill Frankel. Be Well's our corporate wellness organization. We're a Solon-based company, but we serve clients all over the country. Founded in 2007, a group of doctors, nurses, registered dietitians make up a big chunk of our folks. Who help people reduce their risk of chronic disease, and that's what we do. 3 basic legs. We screen people. We put in strategies to help people improve their emotional and physical well-being. And then most of our clients, like the library and many of our Solon clients, incentivize their participants or the employees to be up to date on age and gender specific screenings, to work with a health coach, to get screened, to get a flu shot. And the employees may pay a reduction on their contribution towards their health insurance, or they may receive some cash, or it may lower their deductible, and by doing what they're supposed to do to reduce the risk of chronic disease. So we can go on to the next slide. So our overall goal is just that: reduce disease, reduce strokes, reduce cancer, reduce heart disease, reduce diabetes. These are some of the leading causes of death in our country. Number 1, number 2, number 7 in diabetes. And that's what we want to do: help people reduce their risk of these preventable diseases, and help also with that other component of emotional well-being, physical well-being. And more during this crisis and this pandemic, yes, while we're trying to keep people healthy physically, more and more of our requests have been for the emotional well-being. And we've created and developed programs, which I'll go into in a little bit, and all over, because that's what the clients have been asking for. We certainly don't want more diabetes. We certainly don't want more heart attacks and strokes. But boy, our people are suffering. They're hurting. They're hurting emotionally. We're seeing increases in depression, increases in stress, increases in anxiety. People are exhausted. People aren't sleeping well. And what do you have that can help? And we have programs to help all of those and more. So that's what we do. We screen, we put in services to lower risk of disease, and then we report to the organization on how the participants are doing. And we can go to the next slide. So during the pandemic, we've had to make some big changes, because one of the things we do personally is go on site to organizations with nurses. We do this for the library. We do this for a lot of our Solon and non-Solon based companies. We come on site with our nurses, registered dietitians, other healthcare professionals, and we prick fingers. We take some blood and we let people know whether or not they have diabetes. We let people know their cholesterol levels. We let people know their risk of heart disease. We take their blood pressure. And this is, you know, up front, face to face. And we had to manage that and change the way that we do things to ensure the safety of not only the participants, but the safety of our staff and the safety of our nurses that are going out. So immediately getting on track with our own PPE equipment and changing the format of how we do on-site screenings, changing the format and how we come on-site and provide flu shots to organizations, changing our systems in terms of how are we going to get to these people who are now working from home and give them the opportunity to participate in workplace wellness. It also meant a change in our programming and on the client side, the organization side, saying, hey, people have to go to their doctor by August of 31st in order to receive their credit. And we love that, but we're going to have to extend these deadlines and trying to work with all of our clients to say what's right for them. Listen, we don't want we don't want this pandemic. It's already causing so much pain regarding the illness, but there's also people that are now at home gaining weight. They're at home stressed out. Their gyms are closed and they're not exercising. So how do we kind of change and shift our focus and the programs that we're offering to people who are working from home, to people who don't have access to gyms anymore, who don't have access for socialization anymore on site. So really doing all of those things. So we've implemented a lot of programming, changing our on-site biometric screenings. If we go back, we can go back to that one slide. Thank you. We're doing temperature readings at a few organizations who are still day by day. We're checking temperatures of people coming into the door. So that's something we're doing for organizations both in and out of state. We are providing, and here's been a big change for us, is the increase in the number of flu shots that we're providing to organizations coming on site and providing flu shots. And I think last year we did about 7,000, and I think we're over 12,000 already this year. Just the increase in, boy, you don't want flu shot, we don't want the flu, a respiratory illness, along with COVID. It'll just complicate matters. And as this is the start of the flu season, we started providing flu shots. We got our vaccine in third week in August, and fourth week of August, we've been up and running and going on site and providing flu shots in a bunch of different ways. Symptom tracking, and there are organizations that are doing symptom tracking. There's a lot of apps that we've adopted to share with our organizations on symptom tracking and when to stay home, self-administered, or they're again checking temperatures there. We are certainly promoting our clients to make sure everyone's up to date on age and gender specific screenings, because again, this is not a time, and you may not want to get your physical right now. You may want to avoid the doctor's office, may want to avoid the dentist. But again, that can lead to long-term problems. So we want people, if they're in the need of a mammogram, we don't want you not getting a mammogram this year because you don't want to go to the doctor's office, not getting a colonoscopy if it's your year to get a colonoscopy and you're at risk. We want to help our participants catch problems early. Listen, we don't want anyone getting diagnosed with colon cancer, but if you're going to get diagnosed at stage 1. Don't get diagnosed at stage 4. Stage 4, it's going to be incredibly painful. It can take your life, and frankly, incredibly expensive to self-insured companies and the whole health insurance system. Stage 1, it's taken care of, it's less expensive, it's good for you, good for your family, certainly good for the organization. It's that win-win-win that we're trying to create and promote good health and positive medical consumerism. So a huge influx, again, is on the programs that we've implemented on stress management, transition and dealing with change management, anxiety reduction, gratitude. We have a program. The impact of social media and stress is a program we've been providing more and more and more in a web-based format. So we are providing more and more on emotional wellness because that's what our clients are asking for. My partners are physicians. My background is as a mental health professional and a public speaker, doing programs on dealing with difficult people, managing stress and anxiety, managing stress during troubled times, are all things that we've been providing to our client organizations more and more during this pandemic. And that's been, I think, the major shift in a lot of our programming. Yes, we still have programs on weight management, on being a healthy eater, on exercising more, but this emotional well-being, and I'm sure Kevin will talk about this as well, is just really a highlight of what's needed and what's being requested by our organizations. Yes, our clients are asking us for environmental safety and personal protection strategies and long-term behavior change. So one of the things that a lot of our full-service clients are taking care of and adopting is our Way of Life program, which is a cognitive behavioral approach to weight management and long-term behavior change. So it's not enough to just avoid cake once a week. You want to limit and make good choices most of the time and help your family make good choices. So you're living long, living healthy, and create that win-win for the organization and for you and your families. So this is what our clients are seeking, more and more flu shot clinics. And they're asking for on-site flu shot clinics. We're doing drive-through clinics, and they're actually coming up, pulling up, opening their car door, giving them the shot, and then they drive away. If they've never had a shot before, we ask them to sit in their car for 5 minutes to make sure there's no reaction. We're doing this for one of the largest organizations in Solon right now. We're doing on-site and drive-through clinics with full PPE for our people. Again, stress management programs, anxiety management programs, managing multiple roles, which has been, again, more and more people are asking, okay, how do I be a mom? How do I be a tutor? How do I get my kid online? How do I still do my job? And how am I balancing all of these things at once? Expressing gratitude during troubled times. And again, the pros, cons, and effectiveness of wellness checks. One of our clients asked us to do antigen testing, antibody testing, to see, do our people, have they had COVID already? And we've been doing that as well. And what do you do with that data? And that's what we asked them. Okay, we'll come and do this, but what are you doing with the data? Why do you want the antibody testing? And let's say someone's had COVID in the past. What does that mean? Does that mean they can't get it again? Does it mean that they're immune for 3 months or 4 months? And there's so much information out there and misinformation. And what Be Well tries to do is look at the good evidence, look at the good research, and provide that information back to the organization. So one of the things that we're trying to do both internally and externally is let everybody know that they're not alone, both with our own staff and certainly letting people know, the employees know, even the ones working from home, that they're not alone, that we're all in this together. We're trying to help people focus on the things that are within their control. In my own practice, we focus on I, H, and O. I, it's in my control. H, I need help from others to control. Or O, it's out of my control. Help people focus on the things that are in their control and they need help from others to control, and not waste their energy on things that are the O's, the things that they can't do anything about. That just drains them, leaves them empty, and then they're more susceptible to both physical and mental illness. Offer resources if you're an organization like wellness. Promote that. Promote the EAP. Promote financial resources because people are worried about their finances through this. Child and elder care services. And you may be in a situation, or your folks, your associates may be in situations where they can't visit their loved ones, or they're distancing from their aging parents. So what type of other resources are available to help these elderly know they're not alone? What kind of services are there for your kids who are experiencing loneliness and can't be friends and see their friends at school because they're doing virtual school right now? And there's programs out there, there's services out there, and we're helping people get access to those services. Encourage activities that decrease isolation And one of the main things we've been working on in our own organization, as well as promoting to others, is it's a no judgment zone. No one's going to judge you if you are afraid. No one's going to judge you if you want to work from home more. Can we find a way to do that? Can we accommodate that because your elderly mom is at home and you have a special circumstance? There's times where everyone has to be at work in some organizations, but we're encouraging our clients to think of ways to help maintain productivity while allowing people to feel comfortable and not judged for their fear of this very real and very serious pandemic.
Bill, thank you very much. And that, I mean, just exceptional information. And I think key points that I see is, the differences, as you mentioned, more people are working from home, though, and so it may be more difficult to check in on people and keep in touch with each other. And, whereas you might see someone in the office every day and be able to tell, geez, John doesn't look quite right today, but if that person's working at home, I may not have that interaction that I normally would have. And so I think for the employers, again, finding ways, and you made a great point at the end too, decrease the isolation, keep in contact with each other, and those things that are being done differently, and different anxiety, stresses, and the physical and mental aspect of it that's affecting workers. And then I know as we transition a little bit, some of those people, whether they're at home or even in work, may be looking for ways to kind of self-medicate or deal with, their stresses and anxieties in different ways that are harmful to themselves, both mentally and physically, and where they may need some help from someone. And that's where, I'd like to turn to recovery resources to say with Kevin, to give a little introduction and tell us about some of the things that they're doing. But again, kind of the current state of what's going on with addiction and relapse, absolutely the resources available to employers and employees to be able to help themselves and your most pressing needs, touching on those issues. So I'll turn it over to Kevin Beaver from Recovery Resources.
Thank you so much, George. I'm happy to be here with you this morning. And again, Kevin Beaver with Recovery Resources. We're a community-based behavioral health agency. We've been in the community for 65 years, and we provide prevention services, treatment services, and recovery services for people who are living with a mental health diagnosis, alcohol, drug, or other addiction. And, I'm so happy to share with you. I guess I'm going to take a little bit of a different perspective. We're doing a lot of the same things that the other two presenters talked about today. But what, the key for us at Recovery Resources has been staying engaged with our employees and staying engaged with our clients. And that's been the real challenge through COVID. What does health and wellness look like, pre-COVID? Well, it's those normal things that those water cooler organic conversations. You go into work every day, you see the same people, you get that human interaction. And now, most of us working from home, you don't have that. So you have to create that. So it's about engagement. So some of the things that we've done at Recovery Resources to stay engaged with our staff is we've implemented opportunities for people to come together. Like, we have Wellness Wednesdays. And so every Wednesday at noon, people get onto a Zoom call, and we provide a half-hour presentation on meditation or mindfulness or chair yoga or something like that. Just creating an opportunity for people to come together within the organization and just to feel that that you're part of a team and you're part of an organization. We also have Friday Lunch and Learns, where we offer similar programming where, right now we're doing a financial literacy program, so people who are struggling financially right now, who may be unemployed or one of the two, spouses are unemployed in the home. What are some of the things that you can do? So we're working with Key Bank and providing those types of things. Pre-COVID, we would get together with our president and CEO of our company occasionally, but not very often, Now, since COVID, we get a recorded message from her on a weekly basis, giving us an update on what's going on, not only in the community, but at Recovery Resources. You know, what are the things that are coming up that we should be aware of? So it's all about really over communicating with your staff. And that's part of employee wellness is that engagement, keeping that engagement going with your staff. I'm going to go through these slides fairly quickly to you know, so there's some room for, you know, we have time for questions and so forth. But this is just information from the World Health Organization. And, you know, there are a lot of people in this world who are suffering from depression, 264 people globally. Depression and anxiety disorders, you know, they cost our economy and businesses like all of you, you know, over, you know, 1 trillion each year in lost productivity. There's a direct correlation between unemployment and mental health. And if you have a job, that's a protective factor. If you don't have a job, you're at risk for a mental illness, alcohol, or drug addiction. Also, if you are employed, but you're working in a negative work environment, those work environments that aren't providing those supports to their employees, that can increase physical and mental health problems, substance use issues, absenteeism, and lost productivity. So the workplaces that are promoting the mental health and supporting their people, like Bill was referring to, a lot of his programming, a lot of the programming that we have here at Recovery Resources, they see reduced absenteeism, they see increased productivity, and therefore the financial gains as well. If we can move to the next slide, please. And so, you know, what we're all dealing with COVID-19 is the morbidity and the mortality caused by this specific disease. So, you know, morbidity is the amount of disease in a population, and the mortality is the amount of deaths in the population. And all of you know from what you're hearing in the news is that those numbers are extremely high for this disease. And so it causes that reaction in US adults, that you're seeing more depression, you're seeing more anxiety, because everyone's worried about, okay, we've got this uncertainty out there, we don't know where it's going. You add on top of that the physical distancing and stay-at-home orders. You know, we as humans, we're meant to interact, we're meant to have contact on a daily basis with one another, so that compounds the problem. And so this was a Center for Disease Control. They did a study, just a glimpse of time, you know, in June of this year, and they found that 40% of all US adults reported struggling with a mental health or substance use problem. That's a significant number. Usually it's 1 in 4 US adults will have a mental illness or struggling with some sort of mental problem or substance use problem. So going from 25% to 40%, that's significant. So that's what we're dealing with today. You can go to the next slide. This is just data that's taken from our medical exam, you know, the Cuyahoga County Medical Examiner's Office, and I just want to point out that overdose deaths are on the rise again. You know, there were 52 deaths reported in May, which is extremely high. You know, through May, we've had 166 deaths in Cuyahoga County and surrounding counties in that area. We can go to the next slide. And what you see on this chart is take a look at the line graph on the top, the orange-brown one. That's the that's the line that's the total overdose deaths per year. And you see that spike at 727 right there. That was in 2017. So we saw from 2015 it go from 370 to 727 deaths, and that's mainly the opioid epidemic that we were dealing with. So we put all these things like Project Dawn in place to help people and to get them the help that they need, and to equip people to know how to administer Narcan, things like that. The spike went down. Well, now, you know, now we're on the uptick again. And in 2020, even though we haven't finished out the year, they're expecting the number to be around 628 overdose deaths this year. So it's on the rise again. It's, you know, people are coming to Recovery Resources and trying to get help, but others are not, and they're not getting the help that they need. Go ahead to the next slide, please. So I just threw this in here, you know, from the matrix. And this is what we were all faced with back in March. And this is what Recovery Resources was faced with. How do you continue to provide services to the people who need it most, and the people who are developing mental illnesses due to the COVID pandemic and the other things that are going on today in the political climate and racial injustices and things like that. And so we've all had to switch gears. And at Recovery Resources, we're providing telehealth services. Go ahead and go to the next slide. So the advantage of telehealth is, yes, we're able to reach more people, but you also lose something in telehealth. You lose those nonverbals, you lose those facial expressions when a counselor is trying to work with a client. And so those are some of the challenges that we're facing. But I just want to leave you here with the last couple slides. A lot of times the first place that you want to turn to, if you've never experienced these symptoms before, go to your family doctor, talk to them. That's probably someone that you've known for years and you have that trust, and they can point you in the right direction. Absolutely contact your EAP if your company provides that for you. If you're looking for what services are available and you have someone who needs help, a good place to start is by calling 211. That's run by local United Way, and that you'll immediately be connected with someone who's been trained on asking you the right questions and then connecting you with the right organization that's going to get you the help that you need. Of course, you can go out on the internet and find a counselor. You've got the mental health agencies like ours here in this community, private practices. Of course, if it's an emergency situation and someone that's having suicidal thoughts or ideation, you want to get them to the hospital and call 911 immediately. There are peer support groups that are happening all over our community that you can connect with. Go ahead to the next slide, please. Mobile crisis is run. Excuse me, I apologize. Mobile crisis is run by Frontline Services, very similar agency to ours at Recovery Resources. You can call them anytime. They will come to you and to that person who is in crisis. The Alcohol, Drug, and Mental Health Services Board of Cuyahoga County, they're a great resource. You can contact them or reach out to them on the internet. You got Recovery Resources, you've got NAMI, you've got SAMHSA. All of these websites, if you go to them, you're going to see all of the agencies like ours and know how to connect to them. When you call, if you ever call 911 and it's a mental health or substance use issue that you're calling about, request a CIT trained officer, a crisis intervention trained officer. These are officers who have gone through at least 40 hours of training to know how to deal with a situation where it's involving mental health. And of course, these are all the suicide hotlines. You can get this information after the presentation, I'm sure. And then last but not least, what we're seeing a lot of is requests by employers and community or libraries and so forth for mental health first aid. And this is a program that's international. It came to the United States back in 2007, 2008, and it's very similar. Think of your first aid training that you've had. Well, this is mental health first aid training. So you can be training your staff to know the signs and symptoms of mental illness. And like Bill was saying, with physical illnesses, with mental health illnesses, it's so important to get that help early. Most people wait 10 plus years before they seek the help that they need when they have a mental illness that is developing. So mental health first aid is again something that you can provide to your staff, and you can reach out to us if you want more information about that. Okay, thank you.
Thank you so much. Boy, that is just some tremendous information and a lot of great resources that people have available to them to address these issues. And I think a couple of points, at least that I kind of take away from that. Number one of the things you mentioned about the very dramatic increase in the depression and those type of things that a lot of people are experiencing. I mean, 40% is a big number. And I think there's probably a lot of people out there say, oh, geez, I'm having a tough time, but maybe it's just me, that everyone else seems to be doing so well, but I'm not. Or those that aren't being checked up on or aren't connecting with folks. And I think, being sensitive to the fact that employees and other people are having a tough time right now, and many times are not seeking out the help. So I think it's, as employers too, to be brave and be courageous and look to help those folks, look to be more sensitive, and as employees to reach out when things aren't going well. I mean, we're all in this together. I think that's an excellent point to keep in mind as we're working with how do we best support our employees and our workers to make sure that they're healthy and that they're well. Not just the fact that it makes our business run better, but just as the individuals that they are, that this is an extremely difficult time for a lot of people in so many ways, and that there are a number of just exceptional, excellent resources, Be Well Solutions, recovery resources, and others that can help and help those folks in really meaningful ways. So that they don't get worse and the businesses then are not affected either. Well, I know,
absolutely.
And thank you for that. Really excellent points, everybody. I mean, I've learned a lot. You've probably seen me, looking down a few times. I mean, I've been making notes about some of the things on the slides because I think there's a lot of excellent information. I know we're from a time perspective. Tom, did we have some questions that had been sent in by any of the participants that we wanted to cover?
I grouped today, no questions. I think everything got answered, but just some great resources that were out there for folks, and just reminding folks that this will be available. This information will be available on our website as well as our YouTube channel for follow-up.
But I think that the one of the things, and a couple of points that we had brought together, just a couple of very quick things, because we all talked about it during kind of our pre-planning meeting for this, is, there is no one size fits all to any organization or to any individual. And it does take some certainly looking into to figure out, well, what may be best for my organization, and which also challenges then Be Well and recovery resources and others to come up with things that are a little bit different to address the new challenges that every individual is facing. Some of the silver linings there might be that maybe we are paying a little bit more attention to each other and how we're all doing during this time frame. And that, may be a good thing, and where we may have employers who are now perhaps a little bit more in tune with looking for ways to help their employees. And again, that wellness, not from just the physical aspect, which is important, but the mental aspect, helping those who need help, but also to, to help improve everyone. And, hey, Bill, like one of the things you mentioned, the way of life. I mean, okay, if it gets people to think more about, oh boy, maybe I have put on a few pounds when I'm working from home, maybe that's going to get them to do something that they hadn't done or wouldn't have done otherwise. And Kevin, again, some of the things you talked about, where if people are feeling more stressed, well, that may just be a culmination of something that has been going on for them for a while, may get them then to seek some assistance that will help them better in the long run. So thank you all so much for everything that you've presented today. Julie, too. I mean, being in the public space where you can't control who comes in and out, where and your staff having to deal with those people that come in, I know presents its challenges, and it gives a different perspective on many of the things that have been going on. I want to thank everyone, especially our three presenters. I mean, Julie, Bill, and Kevin. I mean, this has been, in my opinion, extremely informative and useful. A lot of great information. And thank you too to our program committee, Tom Bennett, Kaylin Mills, Denise Mulholland, and Julie Liedtke for putting all of this together. Do also want to recognize and thanks a couple of other participants, our Solon Mayor, the Honorable Edward Kraus. Ed, thanks you for being on the call today. Also, we have too, Rebecca Armstrong from State Treasurer Sprague's office. Rebecca, thank you very much for joining us today. And I know we have about a minute. Mayor Kraus, I'd be happy to turn the floor to you for just a second or two if you have something that you'd like to add for us.
So I just thank to Julie, Kevin, Bill, great presentation. We face a lot here. Obviously, we have a lot of employees who are on the front lines. I think about, our senior center who's made over 11,000 outreach calls to our seniors. I think about our paramedics who have to go into COVID homes for someone, who has a heart attack or stroke and have to transfer people to the hospital. And our police officers who, it's a very interesting time to be a police officer in our community policing work. And one of the things our police officers do, we have a safe passage program. So if you have an addiction issue, you have a depression issue, a mental health issue, you can actually walk to the police department, and instead of getting arrested, you get treatment. They find you either an outpatient or an inpatient program. And that's a great way for our police officers to really connect to people and really help them in times of need. So I'm just very proud of all of our employees who have just gone above and beyond the kind of things to connect our community, to make sure our community is safe and healthy in terms of their physical health and their mental health. And so something that our employees just do every day. And it's just a testament to the workforce and the community. So thanks all to great presentation today.
Thank you, Mayor. I appreciate that very much. And I think one last point, just quickly, that here in our community in Solon, especially having Bill and Kevin and others, I mean, we have just exceptional amount of resources and extremely talented, experienced people that are available to help and to improve people's lives. And that we're very lucky for that. And Bill, Kevin, and then also having the library as a resource, because there's just a lot of great things that are going on there from an activity standpoint when they can and how they can, but also getting information and keeping community connected. And those are important things. Tom, if you had anything that you wanted to wrap up for us with a couple of final announcements, otherwise I'd say thank you so much to everyone for participating, and thank you to our presenters again. And Tom, are there any other announcements?
We are good to go.
Okay. On your screen, we've got, again, on November 11th, we've got another program coming up, Where Are We and Where Are We Going, from the Western Reserve Safety Council. Please sign up for that if you haven't already. We've got a Heritage Coffee grand opening that's coming up on the 18th. And with that, we'll close it out. Thank you so much to everyone. Have a great, great day. Be well and stay safe.
Incorporate, be well, recover, and go to the library.
Excellent.
That's our next one. Thank you, guys. This was awesome. So much great information for attendees, and then that we can also push out as follow-up on our website and YouTube, et cetera. This is fantastic. I really appreciate you guys taking the time to do it. No, it helped me.